Hi, I'm Dr. Sara Goldgraben, Assistant Professor of Specialty Medicine at California Health Sciences University. I'm a board-certified preventive medicine and public health physician with a dual master's in public health and business administration. At CHSU-COM, I teach in the Culinary Medicine course, doing a clinical case for all of the courses that you learn over the first and second year. I also teach preventive medicine topics throughout the 2 years of curriculum. In the preventive medicine classes, students learn in their course, for example, in cardiovascular system, how to have a heart-healthy diet, what you can do to keep your heart healthy, and lifestyle factors that are important, like not smoking, in order to stay healthy. So we go through the curriculum, and in each system, when we do renal or other systems, we learn what is the prevention part of it so that we can learn how to teach patients how to stay healthy before they get sick. I'm the first physician in my family, and so it was all new to me, but when I was in high school, I did an internship in a local hospital in the ER, and there I rotated and learned from other physicians, and I got to see what they did, and I was really interested in becoming a physician myself. I hope students learn in medical school not only the academics and how to diagnose and treat a patient, but the ethical stuff about medicine. So when you go out in the field and you're seeing patients in the hospital, there's going to be ethical things that come up, and doing the right thing as a physician is so important.